Good morning, I am Dr. Mala Kamble. I have worked as a professor and head in Government Medical College in Nagpur. I have also worked as a Commonwealth Medical Fellow in Edinburgh's Hospital, Cambridge University for 2 years in the Department of Vitreous and Retina. I retired from Government Medical College Nagpur in 2007 and then I joined Jawaharlal Nehru Medical College, Sawangi in 2007 and worked as a professor and head in JNMC Sawangi for 12 years and then I left JNMC. Today's topic for the lecture is describe the position, nerve supply and actions of intraocular muscles. There are 3 intraocular muscles. These are also known as intrinsic muscles. They are ciliary muscle, sphincteropupillae muscle and dilator muscle. The ciliary muscle develops from mesenchyme within the choroid. It arises from the scleral spur. Here you see the complete ciliary body and major part of the ciliary body is occupied by the ciliary muscle and the rest of them they are the ciliary processes. The ciliary body is divided into 2 parts, pars plicata and pars plana. This is continuous with the iris and continuous with the choroid posteriorly. Ciliary muscle, you can see it here occupying the maximum part of the ciliary body and these are the ciliary processes which are attached to the lens via the zonules. This is the cornea, this is the anterior chamber and this is the iris. Just behind the iris you see this is the posterior chamber, this is the site for the sphincteropupillae and this is the site for the dilator pupillae. This is the crystalline lens and attached to the ciliary process via the zonules. So, origin of the ciliary muscle is from the scleral spur. The scleral spur is just a fibrinous ring on the inner side of the sclera and it close to the trabecular meshwork. The ciliary body has 3 layers of fibers. One is longitudinal nerve fibers which are inserted in the suprachoroidal lamella and longitudinal fibers they are the outermost fibers. The second layer of the ciliary muscle is radial fibers which are inserted into the connective tissue at the base of the ciliary process. And third layer of fibers is the circular fibers which is the innermost layer of the ciliary muscle. These are the longitudinal nerve fibers, outermost layer near the sclera. This is the second layer, radial fibers running radially and this is these are the circular fibers. All these fibers they originate from one space that is the scleral spur which is nothing but a fibrinous ring which is close to the trabecular meshwork. And all these fibers originating from scleral spur and they have a different insertion. This is inserted into the choroid. This second layer is inserted to the connective tissue at the base of the ciliary process and third is inserted to this the zonular fibers. But when these muscles act, they act together, cause a contraction of the ciliary body and helping to open the trabecular meshwork. So, these ciliary muscles they have a major role in the accommodation and opening the spaces of the trabecular meshwork. The blood supply of the ciliary muscle is through the long posterior ciliary arteries and veins are drained into the vertex vein. The nerve supply of the ciliary muscle is short ciliary nerves, that is the parasympathetic fibers in the oculomotor nerve which synapse in the ciliary ganglion. And the major role of the ciliary muscle is in accommodation of the eye and regulation of the trabecular meshwork pore size. So, this is the nerve supply here. You see, this is the midbrain, where these are the nuclei of the third nerve, oculomotor nerve. This is the efferent nerve of going to the eye, and these are the parasympathetic efferent fibers going to the ciliary ganglion, making a synapse, postganglionic nerve fiber starting, that is a short ciliary nerve, and going to supply the ciliary muscle. The another one, again the parasympathetic fibers postganglionic starting from this synapse and going toward the sphincter pupillae to supply the sphincter muscle. So, when and major action of the ciliary muscle is as I told you, the accommodation and regulation of the trabecular meshwork pore size. Now, what is accommodation reflex? During the accommodation reflex, there are three things happens, and first thing is that there is increase in the curvature of the lens. Second thing, there is a constriction of the pupil, and third, there is a convergence of the eyes. So, whenever we look at the distant object, the rays coming from the distant object, they are parallel and they are focused on the retina without any change in the lens. But this is not the thing when we look at the near point. In near point, the rays, they are divergent and they are to be focused on the retina. So, what happens? There are changes in the lens, and what are the changes? When there is a contraction of the ciliary body, the loosening of the suspensory ligaments, and there is increase in the curvature of the anterior surface of the lens, it becomes more convex. See the difference between the lens here and the here, it has become more convex, and this convexity increases the dioptric power of the eye, so that the rays coming from the near objects, they are focused properly at the fovea of the retina, and thus the sharp image of this near object is formed on the fovea, and then we can see the near prints clearly. So, this whole process is known as the accommodation. So, when we are looking at the distance object, we are not using any accommodation, but accommodation is very essential when we perform the near work. This is the accommodation reflex. The afferent nerve, that is the optic nerve, the retina is stimulated, photoreceptors are stimulated, the signals go to the optic nerve, then goes to the optic chiasma, optic tract, lateral geniculate body, and reaches to the visual cortex. From the visual cortex, it goes to the midbrain, the signals goes to the midbrain and goes to the Edinburgh-Westphal nucleus, and the impulses goes via the oculomotor nerve to the ciliary muscle. Here is the same thing, but I will explain this here also. The impulses from the retina goes via the optic nerve to the optic chiasma, then to the lateral geniculate body, then here the lateral geniculate body goes to the visual cortex. From the visual cortex, the impulses going to the midbrain pretectal area to the Edinburgh-Westphal nucleus. This is the oculomotor nerve. The impulses again coming back to the eye, and here is the first, this is the synapse ciliary ganglion. From the ciliary ganglion, postganglionic nerve fibers going to supply the ciliary muscle. So, this is the whole is the accommodation reflex. Here is the afferent nerve, is the optic nerve and efferent is the afferent is the optic nerve and efferent is the oculomotor nerve. Coming to the sphincter pupillae again important intraocular muscle. It develops from the optic curve neuroectodermal along with the iris epithelium. It originates from the pupillary margin of the iris. It is a circular muscle 1 millimeter wide located in the pupillary zone of the stroma of iris. Its insertion is at the pupillary margin of the iris. Nerve supply, it is a parasympathetic innervation where the short ciliary nerve, which is a branch of the oculomotor nerve. Blood supply is through the anterior and the long posterior ciliary arteries, which are the branches of the ophthalmic artery. The blood is drained from the sphincter pupillae into the vertex vein, and the main function of the sphincter pupillae is the constriction of the pupil, and second is the accommodation. These are the sphincter pupillae muscle, which are in a circular fashion 1 millimeter wide. It originates from the pupillary margin, and when it constricts, it pulls the iris towards the central part and the pupil constrict. It is a smooth muscle of the eye. Now, what is pupillary light reflex? Pupillary light reflex is nothing but the constriction of the pupil in response to the regulate the light. When you are looking in the bright light, excessive light, large amount of light goes inside the eye, and when it falls on the retina, it may damage the photoreceptors, which is the important layer of the retina. Pupillary light reflex. What is pupillary light reflex? It is nothing but the constriction of the pupil in response to regulate light. Whenever you work in the bright light or where there is excessive light going through the pupil, and when it falls on the photoreceptor area of the retina, there may be damage to the important layer of the retina, that is a photoreceptor layer. So, to regulate the light, to allow only a small amount of bright light, the pupil constrict, and this is known as the pupillary light reflex. Here in this light reflex, optic nerve is the afferent pathway and oculomotor is the efferent pathway. There are two types of reflexes. One is direct in the same eye, and second is the consensual in the contralateral eye. Whenever you throw a light into the one eye, the pupil constrict, and this we call it is a direct reaction in the ipsilateral eye. But the other eye also shows the changes in the form of a constriction of the pupil. So, in spite of non-stimulation to the pupil of the other eye pupil also constrict, and this we call it is a consensual reaction in the contralateral eye, and this is because of the crossing of the nasal fibers in the optic chiasma. Now, when the abnormal pupillary reflex, if you see, that is a dilatation of the pupil or sluggishly reacting pupil or more constriction of the pupil, it indicates, that means abnormal size and reaction of the pupil indicates that there is affection of the afferent nerve, that is optic nerve, or there may be affection of the efferent nerve, that is oculomotor nerve, or there may be a brain damage. So, in all the diseases of the eye, whether it is a glaucoma case or any other case, the pupillary reaction is very, very important. By noting the size, the shape and reaction of the pupil, one can diagnose the ocular diseases as well as any brain damage can be diagnosed on the changes in the pupil. And the neurosurgeon, neurophysician always sees the pupillary reaction. If there are changes in the size, shape and reaction of the pupil, the neurophysician or neurosurgeon will come to the diagnosis what is happening in the brain. So, such a importance of the size, shape and reaction of the pupillary light pupillary reaction. So, here you see the pupillary light reaction. The light is going through the pupil, through the lens and falling on the photoreceptor of the retina. These signals are going through the optic nerve, that is afferent nerve, towards the optic chiasma. From the optic chiasma, it is going through to the optic tract, lateral geniculate body, visual cortex, and from the visual cortex, these signals are sent to the pretectal region in the midbrain, and these signals are sent to the Edinger-Westphal nucleus, which is nothing but the nucleus of the third, that is a efferent nerve. So, this is the third nerve now carrying signals or impulses towards the eye and make a synapse, that is called the ciliary ganglion. From the ciliary ganglion, the postganglionic nerve fiber starts, and this is the known as the short posterior ciliary arteries supplying the sphincter pupillae muscle, and when this reaches the pupil constrict. So, this is the afferent way and this is the efferent pathway for the pupillary light reflex. Now, coming to the second last muscle, that is the third muscle, dilator pupillae. Dilator pupillae, it originates from the outer margin of the iris. It runs radially in the iris. The arrangement is spokes of a wheel of the myoepithelial cells. The insertion of the dilator pupillae muscle is in the inner margin of the iris. It is located in the mid periphery of the posterior part of the iris, anterior to the pigmented epithelium. The nerve supply of the dilator pupillae is from the superior cervical ganglion. It is a sympathetic innervation via the long ciliary nerve. The function of the dilator pupillae, when it constricts, it dilates the pupil when there is insufficient light for a normal function. Now, the difference between the sphincter pupillae and the dilator pupillae is that when the sphincter pupillae contracts, the pupil becomes small, that is a meiosis. When the dilator muscle comes in the action, the pupil becomes larger and we call it as a mydriasis. The sphincter pupillae has a parasympathetic innervation, the dilator pupillae has a sympathetic innervation. The dilator pupil, it arises at the you see in the radial fashion and the sphincter pupillae is in a circular fashion. This is in a radial fashion. So, both the muscles are very important for the eye, making the changes in the pupil. Thank you.